how are you supposed to know the difference between if you have vertigo or low blood pressure, or you've got something going on in your central nervous system that could be causing your dizziness? Here's how to kind of figure out at home whether your dizziness requires you to go see an ENT or a physical therapist, or if it's something you can handle at home. When I'm trying to diagnose someone and figure out if they are having vertigo symptoms, or if they're having low blood pressure, or if they're having a central nervous system problem, it often comes down to what are their symptoms. So if you are experiencing symptoms that last less than 2 minutes long, and you would describe them as the room is spinning, that is typically going to be vestibular vertigo, and it can be treated by seeing a physical therapist for 1 to 3 sessions typically. If you are experiencing instead symptoms that usually happen when you move from sitting down to standing up, or from laying down to standing up, and it feels not like the room is spinning, but maybe you just feel a little lightheaded, a little off balance, you may consider checking your blood pressure and seeing if you have postural hypotension, which is when you move from a low down position to a standing position, your blood now has to pump a longer distance from your heart to get to all your extremities, so you can temporarily lose the same amount of blood volume going to your brain, and therefore we get a little lightheaded and a little dizzy. In that case, you may want to see your physician and talk to them about medications or diet that you can be on to prevent that from happening. Lastly, if you notice that your dizziness also comes with a little bit of discoordination, you're not able to be as coordinated with your movements, or you're losing depth perception, or you feel like your eyes are converging and coming together weirdly, those are all signs that you should probably be seeing a neurologist and getting a workup of your central nervous system to make sure that there's nothing else going on in your brain or in your central nervous system that could be causing these dizzy symptoms. I hope this helps, and if you have any further questions, please comment below. Let me know that you'd like to chat a little bit further and what your symptoms might be, so I can point you in the right direction of who to speak to.